What about having a free market for organ donation? I mean, right now you talk about a constrained list and the impossibility for really sick people to get what they need. Should people be allowed to sell their organs?
Yeah, absolutely. They should be able to. You know, I participated and sold some of my body in medical school, and I had an incentive and two incentives. I wanted to get $35 for a pint of blood, but I also thought I was doing somebody good. And generally speaking, the blood banks were filled. And bone marrow, now they're starting to allow people to pay for it. No, it should be done in the market. It should be done. Ethics can control this. There can be people you can't take advantage of people, but there would be a lot of things, a lot of improvements can be done if families and individuals can make those decisions, and there could be even before death, people could sign permission for this. But I think it should be in the free market and not state regulated, because once you get the state involved, you have shortages. And now then how are those organs distributed? Sometimes politically. You know, if you're on the inside, you might be able to get the liver transplant or the heart transplant and get moved up on the ladder, or you might have a special case and put on political pressure, and all of a sudden they have to capitulate. No, the market could take care of organ transplants, and nothing is perfect, but let me tell you, it would be a lot better than the system that we have today, because we have artificial shortages of organ transplants because of the government regulations.
All right, one last question. If you were in college today, would you still go to medical school and become a doctor in this current environment?
Yeah, I probably would, mainly because overall, you know, I had this incentive to do something in medicine. I have three of my kids are physicians. I never talked to them about going. I never pressured them to go, and never talked to them out of going. But I always thought they had the same motivation, a similar motivation to practice good medicine. And I also believe that even in spite of all our problems today, if they would just give us the right to opt out. The description that was made just a few minutes ago about how Canada finally ruled that a patient could seek medicine outside of the system. And this is why Obamacare is such a threat, because it's trying to make it so you can't go out of the system. But as long as there's an opt-out, the physician and the patients should have a chance. There's a lot of burdens, but what business can you get in today that you don't have to put up with, federal agencies, whether it's EPA or OSHA, land control, FEMA, all these other things. So it's this concept of liberty that is the problem that at this present moment. It's affecting medicine more than anything else. But it's the cause of liberty that we should champion, not just free market medicine, because that's one major segment of it, but it's liberty that we should cherish.
And we do, and we cherish having you on. You can see more of Dr. Ron Paul on the Ron Paul channel, ronpaulchannel.com. Thanks again.
Thank you.
All right.